Hello and welcome to the Mental Health Awareness video series. My name is Dr. Lynette Hillsberg and I am a counsellor. The subject of mental health is rarely discussed. Knowing what can control or change our mental health is important. We need to understand why we feel different and how the choices in our lives can affect our overall mental state. These videos are aimed to help open the conversation to bring awareness of this sensitive topic and encourage people to reach out for support if needed. The information will benefit the deaf, hard of hearing, vision impaired and hearing communities because the information is given in sign, voice and closed captions. As Auslan is my second language and out of respect to the community, I feel it's important that I have a deaf person sign on my behalf while I do voiceover. I would like to introduce James as the interviewer and Trisha as my deaf person who have agreed to help me raise awareness around this sensitive topic. I'd also like to acknowledge the traditional custodians of this land and pay our respects to the elders past, present and future, for they hold the memories, traditions, culture and hopes of Aboriginal Australia.
Hello and welcome. Today we are talking about people who have major mood swings. Often these people are assessed by a doctor or mental health practitioner and diagnosed with bipolar disorder. With me today I have Dr. Lynette Hillsberg, who will explain what this means. Welcome Lynette and thanks for chatting.
Thanks James, it's a pleasure to be here.
So tell me briefly, what is bipolar disorder?
Bipolar disorder, it's a complex condition that is often underdiagnosed by the doctor, or it's even misdiagnosed by some practitioners. For their diagnosis, the example is the doctor might see the person might have depression, give a diagnosis, but that's not right. And then they see the mood swings and it's actually more that. So it's defined by recurrent or cycling patterns of manic and depressive episodes. The happiness, sadness.
So what are the symptoms?
Well, they can range from mild depression, major depression, or there's another thing called hypomania. And that's mania as well, where you sleep, you're not sleeping, you're awake for many days. You've got energy, your mind's racing, your thoughts are going, you're confused. You've got psychosis, and under this, you've got delusions and you've got hallucinations. So with delusions, they think they've got special power, they've got control, invisible control, and they think their thoughts are being broadcast. With psychosis, they can feel, taste, smell, but they can also hear voices talking to them, and other people see this and notice that, and they think because they're making loud gestures. So I'm going to use this sign for today's conversation for psychosis. So many people with bipolar disorder spend a significant amount of time experiencing these symptoms that are below the threshold for diagnosis, but these symptoms continue to impact on their quality of life.
So how is bipolar diagnosed?
Well, the old name to start with, it's a bit of background, and it was formerly called manic depression. It caused extreme mood shifts ranging from mania to depression. It's difficult to differentiate from other psychiatric illnesses because that includes schizophrenia and major depression, because there's no specific test to confirm the diagnosis. Doctors are guided by the Diagnostic and Statistical Manual of Mental Disorders, that's called the DSM.
Are there different types of bipolar?
Yeah, there's four major categories outlined in the DSM, and these are bipolar 1 disorder, bipolar 2 disorder, cyclothymic disorder, and bipolar disorder due to another medical or substance abuse disorder.
Because there are different types, are there challenges in diagnosing the right one?
Yeah, bipolar can be really difficult to identify and treat. Symptoms of hypomania and mania often result in an alternative diagnosis, often major depressive disorder, and the consequences of misdiagnosis could be life-threatening. As bipolar disorder is a more severe condition with frequent, recurrent and significant comorbidities. So bipolar is more serious because it's parallel with other psychiatric diagnoses and anxiety, ADHD, medical problems like obesity, diabetes and migraines.
Is there an easy way to understand this, and can you put it into a simple picture?
It may be easy to understand bipolar as a spectrum disorder. So at one end there's schizophrenia and the other end of there's bipolar. And within these spectrums you have the seriousness of symptoms that occur on two axes, proportional ratio and severity. So axis 1 is there's low sleep, like grumpiness. Fast talk becomes an imagination, delusions, hallucinations and erratic behaviour. Axis 2 is where you're angry, have low self-esteem, fear of losing people, instability in relationships and with friends or family, and you get feeling bored or you feel empty.
So, how does the doctor diagnose this? It sounds quite complicated.
Yeah, to diagnose the person, the doctor has to look at the ratio of symptoms that impact the person, which includes like mild depression, major depression, hypomania, mania, and major depression. They look at the severity of these symptoms, and this classifies a person's condition into bipolar 1 or bipolar type 2.
What levels of severity are there in the disorders?
Well, most severe of the diagnosis are psychotic and non-psychotic major mood disorders, followed by minor mood disorders, personality disorders, and finally onset of occasional symptoms as asymptomatic. That's where there's just no symptoms.
So, why is this so difficult to diagnose?
Well, because most people with symptoms of depression are much more likely to seek help than those experiencing mania.
I know what depression is, but what do you mean by mania? And what are the symptoms?
Mania, or manic episode, is characterised by an extended period of abnormally elevated mood, intense energy, racing thoughts, and other extreme or exaggerated behaviours. They can also experience psychosis, it's hearing voices, including hallucinations, delusions, and that indicates a separation from reality.
So, what causes mania?
Possible causes are high levels of stress, changes in sleep pattern, lack of sleep, or if someone is using recreational drugs or alcohol.
I have young children and lead a very busy life. Often I don't get much sleep. Can this happen to me?
There is a difference between normal things like broken sleep when you have children and worry of daily living that can impact on our lives and mood swings that can lead to psychosis.
So, in bipolar, what does the person experience?
Well, people have bipolar, they experience cycling mood swings, and these are called phases.
And what happens in these phases?
Well, there's usually key signs in a phase of bipolar disorder. And these are feeling overly happy or high for long periods of time and then having a decreased energy, talking very fast, often with racing thoughts, feeling extremely restless or impulsive, becoming easily distractive, overconfidence in their abilities, engaging in risky behaviour like having impulsive sex, gambling with your money, your life savings, or going on big spending sprees.
So, how does the person feel during these phases?
Well, often the person's unaware of the changes as they can be subtle. For example, the self-esteem rises, they have grandiose ideas. It makes sense to them, but not to others around them who's looking at them. They may feel invincible because of the increase in energy. They become restless, don't understand why they can't sleep, so they use this extra time and energy and throw themselves into work or a project like cleaning the house or renovating, and this could last for quite a few days.
And are there any other signs?
Yeah, they also become impulsive with their decisions, like buying things online or TV shopping. They might even buy really expensive things like cars or boats, bikes, taking out loans without talking to their partner or their family.
That sounds bad. Anything else that may happen?
Yeah, their speech pattern quickens. They may become sexually provocative or aggressive, and at the same time deny that anything's wrong when challenged about this.
Okay, so how would you know this is happening if the person isn't verbal and only uses sign?
That's a good question. It will be the same effect as when somebody uses alcohol. Your communication and signing is affected by your brain function, so when the person becomes unwell, they're going to have a change in their signing pattern and not make sense when communicating or make unusual decisions when spending their money.
And when does someone normally get diagnosed with this?
It's fairly common. 1 in every 100 people will be diagnosed at some point in their life. It can occur at any age, although it often develops between the ages of 15 and 19 and rarely develops after 40. Many people are able to live independently.
And how does someone get this illness?
Factors could increase the risk of developing bipolar or act as a trigger for the first episode, include having first-degree relatives such as a parent or sister or sibling, periods of high stress such as the death of a loved one or traumatic event, drug or alcohol issues.
So, can you tell me a little bit more about the different types of bipolar?
There's 4 common types of bipolar disorder, but 2 of these types are most often diagnosed.
Right. So, what are these?
Well, the first one is bipolar 1 and used to be called manic depression. That's where your mood swings go over. The phases are clear and the behaviour shifts in mood are extreme. They quickly escalates until they're out of control. So the person may end up in the emergency room and admitted to hospital.
And how is bipolar 1 diagnosed?
So the person must have manic episodes that include shifts of mood or behaviours that differ from their normal behaviour. And these must be present every day, nearly every day during the episode, and at least 1 a week. And to be so extreme, the person needs immediate hospital care. And they typically have depressive episodes as well, but it isn't essential to make the bipolar 1 diagnosis.
Diagnosing sounds complicated. Is this very common, and how is this different from bipolar 2?
Yeah, it is. Bipolar 2 is considered more common than bipolar 1.
And why is that?
Because it also involves depressive symptoms in bipolar 2. The manic symptoms are much less severe, and these are called hypomanic symptoms, and without treatment the person can deteriorate and become severely manic or depressed.
So, is the person aware of this?
Not really. Often bipolar 2 is harder for people to see their symptoms in themselves. It's often up to friends or loved ones and family to encourage to get help for this type of thing.
Do you have an example of this?
Many years ago, I had a client who worked in sales and their job involved travelling a lot, and one time they forgot to take their medication with them. They believed they'd be okay as they'd only gone from home a couple of weeks. They had scripts with them thinking they'd get some medication if they started to feel unwell.
Ah, that makes sense.
But after the first week, the person said they started feeling fantastic with no medications. They didn't bother to get any more from the chemist. They didn't think they needed it because they felt so good.
So what happened next?
Well, the car broke down, and normally when this happens, you call roadside assist or get your car towed. Get it fixed, then call your next appointment to explain, and you'd reschedule.
That's right.
Yeah, because she was becoming unwell, her insight and her judgment and decision-making process had deteriorated. She abandoned her car at the side of the road, hitchhiked with a truck driver to her next appointment.
Well, that was dangerous.
Yeah, she didn't realise she was becoming unwell and started hitchhiking up and down the coast, going with different truck drivers as well as becoming promiscuous in her behaviour with these drivers.
So what happened to her?
Well, she was really unwell, and it was only one of the truck drivers realised that she was hallucinating, couldn't communicate properly, and brought her into the emergency department for treatment. She was then admitted to the ward, given medication within a few days, aware of her behaviour and her situation. She was then able to get her car fixed, return to work, once her insight and judgment and decision making all returned to normal.
Wow.
Yeah, her insight and judgment really deteriorated along with her behaviour, and she was really lucky she was brought into the emergency department by the truck driver.
So these are examples of type 1 and 2. You mentioned before there were other types. What are these?
So there are two other types of the disorder that are less common than bipolar 1 and 2. The other one is called cyclothymic disorder, and that involves changes in mood and shifts to bipolar 1 and 2, but the shifts are often less dramatic in nature.
So what happens with this type?
Well, the person with cyclothymic disorder can often function normally without medication, though it may be hard. Over time, the person's changes in mood may develop into a diagnosis of bipolar 1 or 2. The final one is just called bipolar disorder, and this is a general category. A person only has some symptoms of bipolar disorder, which is caused by a medical condition or substance abuse, and these symptoms are not enough to make a diagnosis of one of the other three types.
So what's the treatment for bipolar disorder?
Once you have a diagnosis, your doctor will decide on a treatment program that works best for you. Treatment for bipolar may include medication, behavioural therapy, substance abuse treatment, electroconvulsive therapy.
So who decides the treatment? Is it your local doctor?
Usually the person is linked into a treating psychiatrist, and they coordinate treatment in conjunction with the GP. The person may also link with a social worker, psychologist or psychiatric nurse practitioner for a team-centred approach to care.
What would you say is the most difficult thing with this disorder?
Well, people with bipolar disorder often report difficult personal relationships, social exclusion and unemployment as a result of the erratic and unpredictable nature of the condition.
So, to recap, individuals with bipolar disorder experience profound changes in mood that impact on thoughts, feelings, and behaviour.
Yeah, many feel relief on receiving the diagnosis of bipolar disorder because it helps address previously unanswered questions. For the person, one of the most important things is to develop a coping mechanism, and it's essential in preserving quality of life, including ongoing support, develop personal connections and gaining an understanding of their illness.
Well, thank you, Lynette. This has helped me understand something that I was aware of but didn't know the facts. It was really lovely to chat with you.
You're most welcome, James, and I look forward to chatting with you another time.